Hi, hello everyone. Let's discuss forensic medicine and toxicology questions asked in your NEET PG exam, session number 1, that is morning session. As we expected, there were 12 to 13 questions from FMT and most of the questions were from standard concepts. Let's discuss all these questions briefly in 15 to 20 minutes. The question number 1 is taken from mechanical asphyxia. The question is, during postmortem examination of suspected case of asphyxial death, forensic surgeon noted circumoral pale area around the mouth, around the nose. Crescentic nail marks were found, contusion and laceration of the lips, and also there was a teeth hemorrhage. What is the most probable diagnosis of death? So, options are throttling, smothering, luggage strangulation, hanging. The best answer for this question is smothering, according to K.S.N. Reddy, page number 281. Here, circumoral pale area around the mouth, around the nose, and nail marks, and also the laceration bruise of the lips go in favor of smothering. What do you mean by smothering? The smothering means occlusion of external air passages. Throttling means manual strangulation. In manual strangulation, you will see hard bone fracture, 6 penny bruises. Ligature strangulation, you will see ligature mark which is absent in the question. Hanging, again, very important finding is your ligature mark. Lay face is sympathetic, dribbling of saliva. So that is not given in the question. So the best answer is smothering. So B is the correct answer. And remember, smothering is occlusion of air passages, that is the mouth and the nose, characterized by cyanosis, petechial hemorrhages and congestion. There can be contusion, abrasion, bleeding at the nose, and there is a circumoral pale area. Cause of death is asphyxia. Second question from iron poisoning. Which of the following is contraindicated in iron poisoning? Options are ball, deferoxamine, desferamine, EDTA. It's a very simple question. Ball is contraindicated in iron poisoning. So according to K.S.N. Reddy, 35th edition, page number 393, ball is contraindicated in iron poison, cadmium poison, peanut allergy, organic mercury poison, selenium poison, because it forms the complexes, toxic complexes which can affect the kidney. So the ball is the correct answer, also known as dimercaprol, British anti-levisite. This is the dimercaprol. Next question is from the postmortem change. Rigor mortis order of appearance. Rigor mortis rule of 12, Nisten rule, Shapiro rule, that is the proximo-distal progression, very commonly asked. This time, very simple, order of appearance. So it is from above downwards. So from standard textbook K.S.N. Reddy, page number 118, that states that it is from above downwards, head to toe is the correct answer. So what is Nisten rule? As you know, that is starting from heart, eyelids, then lastly that is the fingers and toes. So A is the correct answer. And remember, Nisten rule of rigor mortis, that starts from that is heart, then eyelids, neck, lower jaw, face, chest, upper limbs, abdomen, lower limb, lastly fingers and toes. So this is Niston rule. One more rule is rule of 12. One more rule is Shapiro rule, proximo-distal progression. So rigor mortis occurs because of the ATP depletion. Next question from sexual offences. The examination of victim of rape, very important. Here the question about court proceeding in recording of evidence from victim of rape. So as per 3662 of BNSS or section 33 of POCSO Act, court proceeding in recording of evidence from victim of rape, that is in camera proceeding. It is not media proceeding, not closed proceeding or open public proceeding. So answer is B according to K.S.N. Reddy, page number 328. And remember one more point, certain CRPCs we discussed in our previous classes, section 327, that is provides for the power of the court to hold proceeding in camera in certain cases, like example, rape offences, protection of children from sexual offences, and also section 228A that deals with the confidentiality of the identity of the victim. It also comes under protection of children from sexual offences, Juvenile Justice Act, Family Code 1984, protection of women from domestic violence, especially matrimonial matters. In all this, the court has a power to conduct in-camera trial. Next question, the favorite of examiner, seminal stain. In suspected case of sexual assault, anal swab was collected from the victim. It shows the formation of yellow needle-shaped crystals of spermine picrate. This test is classically known as. So whenever you see yellow shaped crystals, your answer should be, that is Barbaro test, because of the formation of spermine picrate. Okay. Tiekman and Takayama, they are done in case of blood stain. Florence also done in case of seminal stain, but it shows dark brown rhombic crystals. So what we can see here, this is the Barbaro test and this is the Florence test. Okay, and look at this. This is how we see the seminal stain under microscope while doing Barbaro test. Yellow needle shaped crystal. They are classical of Barbaro test. Then question number 6, as usual question from Deliriums. A patient had consumed some unknown fruit, came with a history of dryness of mouth, slurred speech. On examination, decreased bowel motility with a loss of bowel sounds. Delirium, dilated pupil is seen. So it's all because of presence of hyoscine, hyoscyamine, traces of atropine in seeds of datura. So the answer is datura. According to page number 454, answer is datura. In cocaine poison also we see mydriasis, but not the other features like that is given in the question. Alcohol, no. Cannabis also, no. The presentations are different actually. So the best answer is datura poisoning. Datura is a deliriant which consists of hyoscine, hyoscyamine and atropine, which give rise to 9D manifestations. 9D manifestations. What is the treatment of this datura poisoning? Your answer should be physostigmine. Physostigmine. Okay. Next, there were two questions from MTP Amendment Act. The question number 7, Pregnant woman who is a victim of rape came to you for MTP, medical termination of pregnancy. MTP can be done up to dash weeks as per MTP Amendment Act 2021. So, in case of rape, incest, disabled women, minor children, so it can be done up to 24 weeks. Correct answer. So, C is the correct answer as per your MTP Amendment Act 2021. And one more question asked, that is about the medical board. Pregnant women with 25 weeks of gestation with congenital abnormalities of fetus came for medical termination of pregnancy subjected to approval from medical board. All are the members of medical board except gynecologist yes, pediatrician yes, advocate no. So the answer is an advocate is the correct answer, not the member of medical board. It's a medical board, not a legal board. So what you can see here, so 24 weeks, beyond 24 weeks, state level medical board approval is needed, which consists of gynecologist, pediatrician, radiologist, other members nominated by state government. Okay, so and remember, up to 20 weeks, one RMP opinion is sufficient. 21 to 24, 2 RMP, more than 24, approval from medical board. Next, question number 9. Question number 9 about PCPN Act. Pregnant mother having 4 female children came to radiologist for USG examination, asked for determination of sex of the fetus. What is your best approach? So the best approach, as you know, PCPN Act prohibits sex determination. So do USG, check any anomalies, don't tell anything about sex of the baby. So that is the most accurate answer for this question. So refuse to do USG, no. Do USG, check fetal anomalies, tell sex of the baby. It's a punishable offense. Don't do that. Uniform police, not the correct answer. Answer is C is the correct answer. So what we can see here, so this is the PCPN Act, Preconceptional, Prenatal Diagnostic Techniques Act 1994. So as per this PCPN Act, every offense is a cognizable offense, non-bailable, non-compoundable offense. So for the first offense, so there can be imprisonment for about 3 years. Second offense can be 5 years. Okay. Then question from sexual paraphilia. A male having desire to cross dress, wearing female dress, high heels, in order to get sexual pleasure, a sexual arousal. What is this known as? This is known as transvestism, also known as cross dressing, also known as eonism. Fetichism, that is by using inanimate objects. Proteurism, also known as toucherism, that is rubbing private parts against the female body part in crowded places. Exhibitionism, that includes mooning, streaking, flashing. So that is not the answer. A is the correct answer for this. The reference, that is from Case and Reddy, 335 is the page number. Question number 11 about age estimation. A 18-year-old rape accused claims himself as 16 years of age. So what is the best X-ray to determine the age? So that is 18 years. As you know, lower end of radius, lower end of ulna fuses at 18 years. So the best is knee joint and the wrist joint. So B is not the answer. No. So according to standard textbook Case and Reddy, page number 55, knee and the wrist is the best, that is for the age estimation for the age, that is 18 years. And the last question is about the child. A child was born after 8 months of father's death. Grandparents filed a case that baby might not their son's child, and DNA came positive. As you know, DNA fingerprinting, that is VNTR, variable number tandem repeats, that came positive, that is for the the father's DNA. So what it is known as, the child born after the death of the biological parent, father or mother, so known as posthumous child. So posthumous child is the correct answer as per K.S. and Reddy 35th edition, page number 309. Fabricated child, also known as fictitious child. Supposititious child, so that is fraudulent child or offspring. Superfecundation and superfetation discussed many times in our classes. So the best answer is posthumous child. So all these are 12 questions discussed in around 15 to 20 minutes. Thank you. Wish you all the best.